Hi, good afternoon, everyone. We'll be starting shortly. My name is Nara from 1237 Ventures, and we are glad to welcome everyone to today's webinar. So today's webinar is in conjunction of the launch of Alpha Startups for Her. Alpha Startups for Her is an accelerator program for FemTech and female-focused solutions. The program is open to startups at any stage, welcoming founders of all genders who address key gaps in women's health.
From the first milestone to the next, women's health and wellness have always been at the heart of innovation. At Alpha Startups Accelerator INNO for Her, we're empowering startups to shape a better future for women. Whether you're building solutions for menstrual health, personalized healthcare, or beyond, this is your moment to innovate. Every woman's journey begins with the milestones of growing up, like menstrual health. We're looking for innovations that empower women at every age. With the right solutions, women can take control of their reproductive health, from fertility to contraception. Maternal health is essential. Innovative solutions can make the journey from preconception to postpartum safer and easier. As women transition through menopause, innovative solutions are key to maintaining quality of life and empowerment. From wearable tech to smart health devices, empowering women with technology is the future. Are you ready to transform the future of women's health and wellness? Apply for the Elite Ventures Alpha Startups Accelerator in NO for Her. Join the accelerator to gain access to mentoring sessions with industry experts to guide your growth, support to help you reach product market fit and successfully launch, digital credits to kickstart your startup, fundraising support, connecting you with a network of investors.
Alpha Startups for Women!
Apply now. Registration closes on February 6th.
So that was a video about Alpha Startups for Her. And here are the 6 key focus areas that we are focusing on this program. You can find more details by visiting the link on the screen, or you can also scan the QR code. So ladies and gentlemen, today's webinar, I want to welcome our speaker for today, Oretha Herrera. Oretha is the founder and CEO of Oretha Senior Care, Sdn Bhd. She aims to redefine the lifestyle of seniors in Malaysia by offering a non-medical senior concierge service to the silver economy in Malaysia. So let's welcome Oretha to share a few words about the aging society, community, women, and the challenges and opportunities that's in this community. Welcome, Oretha.
Hi, Nara, and good afternoon to everyone. Thank you for having me this afternoon. It's been a very busy week for me because we are in the midst of opening up our second daycare center, which we'll share a little bit in a while. Okay, let me just share my screen. So I'm just going to share a little bit about what I do. So good afternoon, everyone. My name is Oretha Herrera, and I'm the founder CEO of Oretha Senior Care. So a little bit of a background of what my business is all about. Like Nara said, I run a non-medical service that provides a service that supports seniors who are living independently by themselves, or maybe they are living with their children, but the children are very busy at work, or they're living away from them. So I started this business in 2019. The aim of, like I mentioned, to provide independent seniors who are living independently the support to go about with their daily life, like especially to hospital appointments, social outings, and just doing basic things like groceries and paying their bills. And in 2022, I expanded my customer base from 10 to double the triple. So now we have more than about 1,000 plus customers in our database. And at 2022 as well, I started hiring concierge on a part-time basis, which I'll share more about what they do. And in 2024, we rebranded our OSCS to Oretha's and registered it as Oretha Senior Care Sdn Bhd, on the focus of becoming a one-stop elder care service center for the community and within Klang Valley, and hopefully throughout all of Malaysia. So what do we do? Like I mentioned, we do hospital companionship, where we bring the seniors for doctor's appointment. We assist them throughout the whole process in the doctor's consultation room, help them with their medical reports, help them to collect medication, and then we will update the children with the report. And quite recent, we opened up a senior daycare center in SS3, We opened up in March 2024. Still at very baby stage, but we are learning every day. It's a very exciting daycare center that we have. And next month, February, we'll be opening up our second outlet in Cheras, in Taman Bilian. So do follow me on Facebook and Instagram, and you will see all our latest updates from there. Besides the hospital companionship, we also help to be more like a home manager to our clients, meaning that we look into their groceries, their billing, anything that needs some sort of a repair in their home. We will update the children and we will just assist them. So, and why are we different from the rest? Because we really treat our clients like our own family, because we provide the services where our concierge is assigned to the same senior throughout the whole time. So they build that type of relationship and confidence within each other, that they know that they can trust my concierge whenever they come and visit them and bring them for their errands and their social outings. So we cover majority of all the government hospitals in KL and PJ. We are all, every day at PPUM. You see any one of us in this blue, the beautiful blue baju, that's us. And all the private hospitals as well. We are mostly there as well every week. So a little bit about me. Okay, everybody always asks me, are you Malaysian? I said yes, very much. I'm a true breed Johorian. I'm Filipino Chinese. Okay, came from a different background of, and from a non-medical background. People think that I'm a nurse and all that. I do not come from that background. I actually came from a fashion and textile design background. But what got me into a business like this is that I grew up learning how to care for my elder folks, not only just my parents, but my grandparents, my grand aunties, and cousins and all that. So we were taught at a very young age about empathy, and somehow or other I just got hooked up just being very close to seniors, and I really enjoy being with them. So back in 2010, when I used to bring my dad for his doctor's appointment in Seremban GH, I noticed so many senior citizens who come from different states of Negeri Sembilan to Seremban GH for treatment, right? They are alone. They reach there very early, and then it's like they don't understand where to go and navigate themselves within the halls, and sometimes we don't even know what the doctor is talking or what type of medication. So in between, while waiting for with my dad, I would try to help them where I can. And I told my dad that one day I'm going to run a service that is going to help the senior citizens to be able to understand what they're going through with the doctor at the consultation room, and understanding what is the medication, so that they have the health support system for them all the time, and they don't have to miss their appointments. So that was how it all started. And it just took one phone call and just friends to share of what I'm doing, and it just went on from there. And it's basically a lot through word of mouth. And I'm really thankful for my community of friends and family who has been supporting me throughout this time. So today, I'll just wanted to share more about the challenges faced by elderly women. I mean, throughout the 6 years I was running this business, right, I realized that as we age and as I see my senior ladies, right, there are a lot of things they have shared with me in terms of what is their greatest achievement, what is their greatest regrets, and what they are going through as a senior women as well. And the most important thing that I really realized that really stood out was mental health. When you talk about mental health, it's not that because people say, oh, is it something wrong with their head up there? It's not about that. It's about the things that they have gone through from childhood to when they are a teenager to an adult to being a wife. A lot of things change for them, because most of my clients are all boomers, right? And we talk about mental health is like, oh, they never had the experience of understanding things like what they go through menopause, what they go through perimenopause and all that, the changes in their body system, osteoporosis, dementia and all that. So for them, it's like, I don't even understand what is happening. Why is this high blood pressure? Seems okay to me. I feel okay, but my pressure is high. And they get stressed over little things like this. And as they grow older, then they realize, like, I mean, they will tell me things. I used to be an athlete. I used to be a businesswoman. I used to be this. But why is all this sickness happening to me now? And you'd be surprised that senior ladies, they do get into depression. People think that no, they should be okay, they're retired, they're enjoying their life and everything. But when you actually sit down and talk to them, like, they are actually going through more than just being happy. A lot of them, when you look about the boomers, I realize, and because my mom's a boomer too, right? It's all about face value. I was just talking to Nara about this, about how when the boomers are in public, in the public setting, and when they're in their private setting, they are very different. And I was very fortunate to spend a lot of time with my senior clients, right? They tell me about um, the depression that they go through because of the sickness that they have, which is always the main thing, and helping them to understand. I think the only thing I always used to encourage them is that to try to do small things better, like exercises, short walks, talking to a friend, going out to the garden. So from the experiences that we've been doing this concierge, it's like when we realize that when we bring them for small walks, have someone to talk to, it makes a lot of difference for them. Okay? And boomers, right? Especially the ladies, when they were married and everything, right? The most of them become um, housewives. They become caregivers to not only to their own parent, but to their in-laws as well and to their children. And after some time, when the children has left the nest, they are all grown up. They feel that they have lost that purpose. Who do I care for? Grandchildren, they're like, oh, never mind, my children will send them to a nanny, so they don't need me to take care of their children. So they will lose that sense of identity. Um, I have an encounter with one of my clients, right, who was previously a nurse. Even though she did well, she was very happy with her working life and everything, right? When the children left the nest and she was all alone, she said, after now I feel that I feel so stupid. Now I asked her, why do you feel stupid? Because it's like I do not know whether I have enough for myself. I do not know whether I have given enough to my children, and I don't even know whether I'm happy. And so because of that, right, they lose that sense of purpose as well. Being alone, especially when they have lost their spouse, to being alone, they feel that my children don't need me, grandchildren don't need me, but who else? It's just me now. So that sense of losing that purpose, right, is also correlated to their mental health as well. And as I just want to say that whatever I'm sharing here is through the experiences from the concierge that I've experienced with some of the ladies throughout the years and all that. The other thing that a lot of these senior lady, elderly women, as they grow older, is like the financial support from the family as well. Like my mom, she was previously working in a lawyer's office, if I'm not mistaken. And then she got married, and then she followed my dad. And my dad was working in the government hospital, government sector with JKR. And when my dad passed away, she was very fortunate to have his pension to live her month, her day to day, every day, and everything, and all that. She has savings and everything. So she's very fortunate to have some sort of money, the same as my mother-in-law as well. But there are some elderly women that I came across who are my clients. Is like the husbands were working in private sector, then they had savings, and then they have the husband may have some sort of issues, maybe like love to play, gamble, like to smoke, like to drink. So these are all added costs for them, right? Especially if you don't have any sort of income coming in anymore. So the woman will feel that, oh my gosh, it's like I don't even have any savings for myself anymore, you know. So then they feel very depressed. stressed about it, and then they have to depend on their children, and then the children has to support the parents and their family, and we are stuck in this generation called the sandwich generation, right, which I am also in as well. That means taking care of my own family, taking care of your parent or your in-law, or maybe your grand aunties, for example. So in terms of these three sectors of the mental health, poverty, the loss of purpose, it all boils down on as they grow older, right, they realize that they think that they could have done better. And then the regrets come, So when I experience something like this with my clients, when I hear them out, I also share this with the children so that they can understand what the parent is going through. Especially, and I realize that all my clients, a lot of them are elderly women. The men, their husbands are passed on and they're left alone and everything. And when they share to me especially about the loss of purpose, it's really touching for me, because I'm trying to understand, and I always ask myself, what if I were in that situation? What would I have done? And I told myself that I don't even know what I would have done. But because now, right, we are very exposed to a lot of information on the internet and everything, you can actually read about it and learn and know how to get yourself into a community. That was the reason why I wanted to have a daycare center, not only just for the community that I have around me, but maybe for myself. I don't know. So these are the very important things that I experienced. Not only just me, but my concierge as well, experience with all our elderly clients, especially the women. So, and throughout this time, when I realized when we are in this situation, right, there's a lot of things that is missing in our gap in our current setup, I would say, right. Firstly, was that we talk about connectivity. We are all of us are in technology stage and everything, right? And I can tell you, when I first started my business, the concierge 5 years ago, my goodness, the seniors, right? I had a tough time trying to teach them how to get connected with WhatsApp. Don't even talk about online shopping, okay? So just getting on WhatsApp, okay? And I think that is very important, because most of the seniors, right, I would say that they moved out from their hometown to be in the city because of the children, because the children didn't want them to be alone, and then they get them to come to KL or PJ, and then they lose out on their friends back in hometown. And I think that learning how to engage with technology is very important. I just want to share that every one of us are we have a parent, right? Please teach them how to do it, to get connected, not only just to you, but maybe your grandchildren their grandchildren who are living overseas, because it gives them that sense of achievement, right? To be able to be connected in terms of technology. And the other thing that is also you can see very clearly is the source of income for senior citizens. True story, in the sense that when I became a homemaker for 6 years, I couldn't find a proper job, part-time basis, right, that pays good enough for me to have a little bit of income to help the family, And throughout this time as well, I do speak to a lot of my friends who are much older than me, in their 60s and 70s, who retire early. Some of them retire at 50, 55, and also can't find part-time jobs as well to earn income for them to sustain for the month a little bit, and this was like a aha moment for me when I started the business, was that how can my business help senior citizens to earn income? And that was through the concierge service. I can share with you, right, when the senior earns a proper income, a decent amount of income, it gives them a lot of happiness. It's not that they earn like but thousands lah for me, okay? I'm just saying, right? But I can tell you whatever, I would say that they are earning a very decent amount. They get every end of the month, and the joy that I can get to help this group of concierge in my team, right? I must say it's a very fulfilling thing because it doesn't come just for me, but it comes from them as well. And that gives the type of satisfaction for me. It's like I may not be able to change the workforce for the seniors out there, but I'm changing what I can in my own community with the people that I have. And that's why it is very important the source of income, right? If anyone wants to hire, please try to think about getting senior citizens. I can tell you, they are very good workers, okay? Not everyone, but if you sit through with them, you interview and tell them and share with them what is the things that need to be done, they can be done. If you have seen the movie Intern, where Robert De Niro was working with oh gosh, what's her name? I can't remember what's her name. Okay, anyway, watch this movie Intern, okay? It's a very good movie. It shows about inclusivity. So the gap in our society is that there's not enough inclusivity of the senior citizens in our community. Everybody wants to have the younger ones. Yes, I know everyone, they have their own um, positive and good points in bringing some sort of things into the company. But I believe that the senior citizens who are young, the young senior citizens, I'll say 50 and above, lah, okay? All right, because I'm 50 years old. So I believe that they all have very good potential. Trust me. All right. The other thing that, and because of source of income, so they gives them, there's a gap in between this, where there's the sense of purpose for them in their life, right? Earning income is wanting to earn an extra, the sense of purpose, but they're in their seniors, and like, oh, what do I do now? You know, I'm trying to find a job, nobody wants to hire me. I get a job, it's too low. By the time I drive here, it doesn't, it doesn't serve the purpose, or it doesn't even cover the petrol or whatever they need to go, right? So the sense of purpose is like, what do I do? So I just sit down, stay at home, watch TV, read newspaper, go and drink coffee and come back and sleep. That's all they do. So there's no sense of something to look forward to, you know. So I believe, like, say, like I've been reading about Singapore, right? How the government has helped the senior community to build their senior, like HDB flats, right? To have community hall, community things that they can do. Simple things where they can just help another senior that's moving in. There will be like a buddy system. So it's not about paying money at the end of the day. It's about giving them the sense of purpose to be waking up every morning and say like, okay, I'm looking forward to do this. I'm looking forward to see this. So uh, yeah, the sense, the connectivity in terms of technology, the source of income for them, and the sense of purpose for them as well. So um, so financial schemes for elderly, all right. I mean, this I was sharing about the schemes of elderly, like teaching them a new skill, so that in order for them to able to um, get some sort of an income out of it. If I'm not sure whether you all have heard of this group called hired 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 leave and hired seniors or something like that. So what this company does is that they hire senior citizens who have retired to companies who are looking for um, positions that's available in, yeah, whether it's Shell or Maxis or something like that. But I really not too sure how is the recruitment rate out of these people as well. But at least there is some sort of opportunity that is given to them where they can go into an online base to earn an income based on what you used to work to give back again to these private sectors. And I think creating a community is very important. I think that should be actually number one. When you have all the time right in the world and you're thinking like, how do I even start, you know? So currently there are groups like Amazing Seniors and Seniors Allowed. So Seniors Allowed is a community-based group where they actually do a lot of fun stuff. Okay, travel, food, games, and everything, and they actually like it's like a recruitment for seniors, right, to be in this community. So they learn new skills together. They actually go out to do things together, and they support each other. They even have like counseling sessions or something that if I'm not mistaken. And if you all heard of University of Third Age, which is under UPM, they have started UE3 um, for quite some time right now, where you can actually learn skills. They teach lessons, language, and all that, but it's actually in UPM Serdang. So, but even though whether it's near or far, the thing is that we need to encourage our seniors to actually be in a community where they can continue to build themselves. And it's a lifelong journey actually. It's lifelong learning for them. It's not about just being when you're a senior, you stop learning things and that's all. I know I just want to sit and relax. It is not like that anymore. I just want to share a story about um, what was the main thing when I wanted to open up the daycare is all about the community. I realized, right, after running this daycare for many months, what we actually do here is actually teaching our seniors uh, something very interesting about empathy towards seniors as well. See, when they come in, right, they are never given that opportunity to be guided or to be taught about why or how dementia or why the senior acts the way how he or she acts. Because when they act, just say for example, if a patient has dementia, right, sometimes they have certain habits they like to walk up and down. And then the other senior like, what's wrong with her? Why is she walking up and down like that? Don't want to sit still, is it? No chair in his place, is it? They will make this type of comments, right? But if that person who have heard it, right, the lady was working, she can retaliate and say, hey, mind your own business, okay? Blah, 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 blah. But how we change it that way, right? We sit down with that senior and we guide that senior about understanding why they are like that, teaching them about dementia, teaching them about Alzheimer's, teaching them about certain clicks or habits that they do. So in our community right now, right, nobody wants to sit down and talk to the seniors about all these issues that come along their way, which they are going through or they will go through in the future. Right? So the lifelong learning journey, right, is it doesn't stop when they retire at 50 or 55, 60. It's even as they are at 80 and 90. My senior citizens in my daycare center, they are 80 to 90 years old. And every time they come here, we are teaching them about social skills again as a senior. We're teaching them about empathy, which is very important because that helps them to understand how to approach their seniors in their community. And through that teaching, right, we realize when the children tell us, hey, my mother now she's very different now, the way how she approaches things, or how she's responsible about doing certain things in the house, right? It makes a lot of difference, because they were given that opportunity to be taught, right, as seniors. Because when we teach them, I tell you frankly, they will come and tell us, like, nobody wants to sit down and explain to us about all these things. I said, there you go. I said, so how do we do it? So we encourage them. When we teach you, you show that action. I said, if you can remember, you go and share it with your friends. Can or not, And then they say, okay, I'll try. So the thing is that in this generation now, right, we are always on fast pace. I understand. I'm also guilty of it sometimes with my own mom, okay? But I realize that as time goes by, right, and I'm in this industry of seeing all these senior citizens, right, you really need to understand that what they're going through, right, is more than just uh, being an old person. Let's put it this way. We have to find that time to sit down to actually ask them, how are you doing? And frankly, I want to share as well, it's like, if the parents, right, and the child has some sort of things that have not been resolved, uh, do it. Do that reconciliation, do that talking, do that sharing, so that you don't leave things unintended. You know, I can tell you one of the mental health things that always disturbs a senior, whether they're women or men, it's about relationship with children. So sometimes um, the parent will tell us, because we are third party, we're not family, so they're easy for them to talk to us. When they tell us the story, right, and then they find it like, say, how about you share it with your child? Cannot, very hard, they won't understand, they got no time, da 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 da. So what do I do when I get all this information? I talk to the children. I say, you know why your parents is going through this stress? You know why they are so mangzan? You know, Chinese will say mangzan, so stressed or that, right? It's because they're thinking about this. And then they won't realize it until when you share about it. And then, you know, they try their best to bridge that gap to have some sort of reconciliation. So when you look at all the stresses that, especially for women, right, the senior women, they bear a lot of burden on them. You see, so when you have the chance, right, just try as much to really sit down and ask your senior what's been going on with them. Yeah, I know it's um, some certain sharing here may not be related to certain things of what the topic is, but I can share mostly is basically is a actually a real true experiences basically. So for seniors, right, I think it's very important that when they have their own social network, they need to have the type of right frame of people to be with them. So children always tell me like, oh, I just want to send them to this place, and then it's not about that. So when you trying to solve a problem like that, right, it's just not about putting in them there and then it solve your problem. You know, you create a community for them, right, where it's a ongoing learn, where they can actually learn out of it, and they are empowered to do something better and be a, I would not say a better person, because they cannot remember and they may not they have certain like characteristics which are very hard for them to change at a certain time and age and all that. But what you want is for them to experience something new and exciting for them. So I believe that women, right, in senior age, what they want in the end of the day, they always tell me is like, I just want peace, I just want to have happiness, I also want to have fun. So so when they talk about having fun, right, it's about creating life, the whatever balance or say whatever left of their life now, right, to have something they can remember towards the end. True story again is like, I have a senior who shared to me about, say that, you know what, in all my life, right, my children always listen to me. They always listen to me. They're very good children and everything. But there are times, right, when they are angry just because of that one thing they do to me. They will shout at me as though I've killed somebody on the roadside at that. So that's the expression lah. So imagine, right? She said there's one incident that happened many years ago, and until the time where until like she's already in her 80s now, she still think about it. So it's like helping them to get out of it, right? We need to help them to really process that as well. So what I'm trying to say is that, like, children and even like community people or NGOs who are dealing with senior citizens and all that, we really have to see what is the root problem for them in the end of the day. Helping them to understand what will actually make them happy, what actually will help them have that type of closure with so many things they are going through there. So, sorry. So, in short, right, to address all these issues about the multi-pronged approach, including more inclusive research, right? Better access to healthcare, financial resources, and support for caregivers, policy changes will help to actually to tailor solutions to the unique needs of the aging women, is to improve the quality of life in later years. The thing is that there's so many things that there's a lot of things that not only just one body or one part of the government or whoever it is, NGO, what to make that change that is missing out in our current senior society. You know, that it takes a lot of other people, a lot of other agencies to come together to see what is the best that we can do for our aging society as well. Like, everybody is saying that Malaysia is coming to an aging population soon and everything, and the government is really trying their best to see how they can support in terms of all of the current situation. And the good thing is that at least now with KKM, Clinic Kesihatan, you know that you can actually go in and do a walk-in dementia check for anyone without making any appointment. So that's a good start for our society and our community for our senior citizens. So in conclusion is that the needs of aging women, they are very diverse, okay, and addressing them requires a very holistic approach. It's not just looking at just one thing, and but we need to look into the overall thing, consider of the physical, emotional, and social and financial aspects of community. So by supporting women in these areas, the society can help them lead a more healthier and fulfilling life as they age as well. So the question is, how do we do it, right? It just starts by just in your own in your own neighborhood. There's definitely a senior that's living nearby. There's definitely maybe with your own parents as well. You know how you can help them to just bridge a bit of that gap for them. You know, helping them with technology, helping them with about learning about financial stuff and everything. They get confused. So it's just about giving our time, that little time that we always say is very precious. And that is the most important thing there's a lot of things that we sometimes find it very hard to give is our time. So how can we start? It's just giving that little bit of just that half an hour maybe to the time to your neighbors. So takeaway is that as even for me, I'm sharing like with my friends and the people that who are around my age group, as I see how the seniors are going through right now, right? I share with them how would you want to live your life as a senior in 10, 20 years time, 30 years time? How would you plan your finances? You know, would you still be working? Are you still going to depend on your children? So these are the things that you should try to talk about it with your spouse or even sharing it with your children. I have 4 kids, and my friends are telling me, my boomer friends, these are boomer friends are telling me like, hey, you're very lucky, you got 4 kids, they all will take care of you and everything. And I just tell them upfront, it's like, I don't expect my children to be taking care of me when me and my husband when we grow old. You know, we have like a plan A and a plan B if anything were to happen to us. And the thing, from the experience of being in this industry, right, I'm hoping that I won't financially burden my children when the time comes. I think it's our responsibility to really know how to take care of ourselves, our health, our mental health, our finances, and I think in our community. I think these are the 3 main important things. Even though it is a challenge for the ones who are currently in their senior age, I believe the mental health, the community, and the finances will be better for our generation because we can work about it, we can plan it, and we can talk about it in the time to come. So give a thought to yourself, how would that resonate for you for the next 20 years or 30 years to come when you are growing older, and how would that going to impact your family dynamics? So something to think about, and it's nothing scary. Don't think it's scary. Growing old is nothing to be scared about. It's just something that we have to face it, and something that we just take it one day as it comes. And I always tell my seniors as well, just take it one day as it comes. You know, the only person who's in control of you is God. That's it. Enjoy your life while you can. Do the best. Take care of your health. Very important. Reminded to myself too. Exercise is very important as well, and communication, so important. In anything that we do, please remember, whether at what age we are at, um, communicating with your loved ones, with your spouse, with your community is very important. Build that form of support system for yourself, and I pray that things will work out well for most of us, actually, including myself. So, with this, I thank you so much for giving me this opportunity to share a little bit of what I've experienced with my clients, also what I've personally gone through myself. And I hope that you have benefited from the sharing that I've
Okay, thank you so much, Oretha, for sharing some very important insights. I would like to open to the floor if anybody has any question related to the aging women group and innovation in this group. So while we wait for some questions, I have some questions here, right? I mean, today's topic is about, aging women. How do you actually define an aging woman? Like in today's age, we always perceive someone aging as our grandmothers who are in their 70s and 80s, but times have changed. So when do women start facing issues in terms of health aging, just general aging,
Oh,
health especially?
I I think there's no age to it now, basically. Yeah, there are some who as early as in their 20s, they are already have health issues and everything. When you talk about aging, in the nutshell, it's basically, I would say that when I think they will say about 60 and above, that kind of thing. But in terms of health, right, it's not about age anymore. It's like I mentioned, whether you will have health issues when it comes to 20s and 30s and all that. But if this age related, I would say that once you hit a lot of people say, oh, when you hit 40, 50, you start all these aches and pains will start coming in. But I think in the end of the day, it's how your lifestyle is from the beginning itself. And I've known um, some ladies or some gentlemen at 90 years old who don't even take any diabetic or high blood pressure medication is because, and I say, so what's the story? Why you are so good? You don't have to take all this medication. All that. No, I just eat anything I like, but in moderation. So in the end of the day, is how you have your lifestyle from the beginning itself. Um, I think it's about being conscious about what you eat right now, what you put into your body, being careful about of intakes of fried food and all that. So I think it is how your lifestyle is about.
Okay. From your experience working closely with women, aging women, right? In terms of health, yes, mental health is one thing. What are the most common struggles in terms of health that they've expressed?
Yeah, a lot. Okay, terms like osteoporosis. Okay, I noticed a lot of my senior ladies go for bone density checks also because you see, when we go through menopause, and especially those through menopause, you will tend after when you go older, you have these brittle bones. So that's why they go through bone density tests to check and to review whether they are at a stage of osteoporosis. A lot of them complain about that. Aches, body aches, also because of it could be sports related or maybe childbirthing related or something like that, right? So osteoporosis is very common. Um, and also women as well as they age, they also tend to have a lot of this UTI, urinary tract infection, you know. Uh, so that is quite rampant. I see some of my clients they actually go through that as well. Yeah. It's something that is treatable as long as it is identified and looked into immediately lah, with medication. Yeah.
Okay. So osteoporosis, UTI. And do you see them wearing any devices, any innovation that you find, hey, this is cool, or this technology is cool that is helping aging women manage their health better? Have you seen anything?
The only one that I've experienced is one of my clients who comes for daycare that she has like because her glucose reading is very high, so she has a device that's on her skin that gives off a certain signal or alarm if it is too high or too low or something like that and that device unfortunately is not available in Malaysia. She got it. I think her son or daughter got it for her in US. So every time there's always like a tick button, right? So it kind of irritates the rest of the senior citizens. So this is what I meant by teaching them to be empathetic about seniors, right? Why she had to wear the device to help her so that she knows how much to put for her insulin later on and all that, right? And they go, oh, okay, right. So actually they're very cute. So when you teach them, right, it's very interesting to see their reaction. So I think that's the only device that I've seen so far that is kind of different from the rest.
Mhm. And just a general question about why do you think innovation is so important in this group of women?
Well, I think it's important because I say when they grow older and as of course as their memory also kind of like decline, right? It helps them to keep in track in terms of their medical condition, especially those like on high insulin, those who are maybe even like very prone to fall. There's also fall detections nowadays. You can put in homes, but detection sensors they call it. So and these things really help them because when they are when the caregiver or the children is not around, this will give some sort of a signal to also alert the caregivers as well. So this like innovation will actually help not only just for the women, but I think in senior in general, basically. Mm.
Mhm. Yeah, like you mentioned, fall detection, we will never know when our elderly will fall, right? So do you think like in terms of innovation, there should be something for the kids as well to like get a beep on their phone, hey, my father, like his
I believe there
BP is
is
high
there
or
is
something.
I
That's
believe
good.
there is, but it's just that how is it available here in Malaysia is another thing. But
Mm.
I would say that some of them have like, but I believe there is. It's just that it's not very openly publicized or marketed as well. Could be because of pricing or whatever, right? But most of it I see they are some in certain aged care homes and all that they do have it, but on a personal basis a lot of them use things like live 360. That one you can do a detection. It's very important for those seniors who still want to drive, all right, and at least the children can detect where they are. That's very important. Tags like a GPS watch, some of them have it, which they also have for children as well. And but the problem is that if the seniors remember to charge it and wear it, then it's good lah. If they don't, then it's another problem altogether. So sometimes we always try to find the simplest thing that will make it easy for the seniors to be able to put on or use to be detected
Mm.
whenever they need to go lah, basically. Innovation is good. It is very important, but the implementing it and follow up is another thing altogether.
Yeah, so startups who want to innovate for this group of women, they should also think about how they can simplify it,
Yeah.
right, to the
Yes.
maximum so that it's very easy for them to use.
Correct.
Like you mentioned earlier, like this generation, the boomer generation find it hard to even install WhatsApp. So what
Correct.
is there, these devices?
Yeah. Yeah.
Yeah.
So that's the challenge, basically. And some of them don't even want to wear it. So let's make it even more difficult. You know?
Okay, so I was just thinking about like, okay, so like there is a large number of women who come to your center who, you know, their kids send them. What do you think about those who are underserved or marginalized communities? How do you think technology can be part of this group of aging women?
The marginal, well, I've not worked with marginalized group before, but I'm in the midst of working with B40 group people, the community, and I think don't even talk about technology lah. The simplest thing of getting transport to the hospital is already a big thing for them, right? What more about getting technology? Some of them don't even have a smartphone. Let me tell you that. They still use a normal analog phone. It's because of their financial situation, you know. So, but I believe if technology was available for them, I know, I believe that it will really help them in terms of keeping track. Number one is like their health care. That means their appointments, their medication that's coming in. I think that's the basic of what they need. Because if they go to government hospitals, even now, you have with these government hospitals like appointments and medication, and you can track through this My Ubat, right? Appointments, of course, is still manual. PPUM is everything is digitalized right now. So we find it sometimes has its pros and cons. But seniors don't know how to monitor that. So the children who is overseas have to monitor it, or we have to monitor it for them. So if like the B40 group that we have right now is like they are still in very manual setup. Nothing on terms of technology will support that part because of not being able to get number one the proper phone. If they got the phone, data is another thing, right? Or Wi-Fi. So it's either that or they go down to the community hall and get connected, which is very troublesome for them, right? And I still think that there's a long way more to go for the marginalized and the B40 group as well to get themselves technologically connected, unless like JKM or what, which we are also working together with, to do something more than what we can give them. I think it is still a long way more to go in terms of technology inclined for these two groups.
Okay, so my last question for today is what advice would you give aspiring entrepreneurs who want to start a FemTech, particularly, you know, addressing aging women's challenges, or just generally, what advice would you give someone who wants to start a FemTech startup or a startup based on your experience?
Well, basically, find your passion. What is the market that you want to get yourself into? All right, and study your competitors. Be different from the rest of them. Uh, give a niche to your clients which the others are not giving. I started my business at 45 years old, which is very late already, right? But I didn't look at age as something to deter me from starting something which I'm passionate about, which I knew that it can make a difference. So if you want to start something like a startup, understand what you want to do your market research, finances, always there's family to help. That's how I started as well. Um, but I think it's understanding what you really want to do. And plan yourself what you want to, how you want to execute that business out into the market.
Very good advice there. So since we don't have any questions from the floor, we shall be ending this webinar soon. Thank you so much, Oretha, for being
Thank
with
you,
us
Nara.
today.
Yeah,
Right.
thanks, Nara.
So thank you so much. So I hope that everyone found this webinar today very insightful. If you are a FemTech startup, do apply to the Alpha Startups, for her, where you'll be able to validate your ideas, achieve product market fit, and grow your business. The program is open to startups at any stage, welcoming founders of all genders whose solution addresses key gaps in women's health. Feel free to scan the QR code and learn about the program and applications. Thank you so much for joining us today.